If your doctor handed you a prescription for blood pressure medication and never once asked what was on your dinner plate, you've been failed by modern medicine. Because the research is now overwhelming. Specific foods, eaten in the right amounts, have been shown in clinical trials to drop systolic pressure by 10, even 15 points. In some studies, faster than a starting dose of certain medications, with no side effects. In my 30 years working with patients over 60, I've watched it happen hundreds of times. 3 things ahead. First, the food most cardiologists eat themselves but rarely tell patients about. Second, the exact daily amount that actually works, because too little does nothing, and most articles get this completely wrong. And third, the single food that in one published clinical trial matched the effect of a common BP drug. That third one will surprise you. But before I name them, you need to understand why your arteries respond to certain foods the way they respond to medicine. Let me explain. Here's what most people over 60 don't realize. Your blood pressure isn't just a number on a cuff. It's a measurement of how hard your heart has to push blood through arteries that, after 6 decades of life, have become a little stiffer, a little narrower, a little less flexible. Medications work by forcing those arteries open or by reducing the volume of blood your heart has to move. They're powerful, and for many of you, necessary. But certain foods do something medications can't. They actually repair the inner lining of your arteries, the endothelium, and trigger your body to produce more of a molecule called nitric oxide. That molecule is what opens your blood vessels naturally. If you're frustrated because your numbers haven't budged despite doing everything your doctor said, I understand. You're not alone. I've heard this same story from patients in my office for 3 decades, and the answer is almost always the same. We've been treating the symptom and ignoring the kitchen. Quick note before we go further. Nothing I say replaces your doctor's advice. Talk to them before changing your medication routine. With that said, let's get to the food. Let's start with the food that has the strongest evidence behind it. The one I tell every single patient over 60 to eat. Dark leafy greens. Spinach, kale, Swiss chard, arugula. I know, you've heard this before, but you haven't heard this. A 2022 study from Edith Cowan University in Australia followed over 50,000 adults for 23 years. The participants who ate just 1 cup of leafy greens per day had a 26% lower risk of dying from heart disease. 26%. And here's why. Leafy greens are loaded with dietary nitrates. When you eat them, bacteria in your mouth convert those nitrates into nitric oxide, the same molecule your arteries make to relax themselves. A 2020 meta-analysis published in the Journal of Nutrition reviewed 43 separate trials. The conclusion? Daily nitrate-rich vegetable consumption lowered systolic blood pressure by an average of 4.4 millimeters of mercury. That's the same drop you'd see from a low-dose ACE inhibitor. But here's where most people get it wrong. They eat a small side salad twice a week and wonder why nothing changes. The dose that moves the needle is 1 full cup of cooked greens or 2 cups raw every single day. Not 3 times a week, every day. Let me tell you about Margaret. She's 68 and lives in Phoenix. She came to me with a reading of 148/92. She'd been on 2 medications for 4 years, and her doctor was about to add a third. I told her to do one thing for 6 weeks. 1 cup of sautéed spinach with breakfast, every morning. Nothing else changed. At her 6-week follow-up, her pressure was 131/84. Her doctor didn't add the third pill. He took one of the existing ones away. Now, food number 2. And this one might surprise you because of the color. Beets. I know, they look intimidating, they stain your hands, but beets have been studied so heavily for blood pressure that the British Heart Foundation has openly recommended them. In a 2015 study published in the journal Hypertension, researchers from Queen Mary University of London gave participants 250 milliliters of beetroot juice every day for 4 weeks. The result? An average drop of 8 millimeters of mercury in systolic pressure. To put that in perspective, an 8-point drop in systolic pressure is associated with a 16% reduction in stroke risk. From a vegetable. Why does it work? Beets contain one of the highest concentrations of dietary nitrate of any food on Earth, about 250 milligrams per cup, compared to 20 milligrams in most other vegetables. How to use them. You don't have to drink the juice, though it works the fastest. You can roast them, grate them raw into salads, or blend half a cooked beet into a morning smoothie. The effective dose is about 1 medium beet per day, or 1 small glass of juice. A warning: beets will turn your urine pink. This is completely harmless and only lasts a day. I mention it because I've had patients call me in a panic, convinced they were bleeding internally. You're fine. It's the betalains. Drink your beet juice in peace. Now, between leafy greens and beets, you've already got 2 of the most powerful natural blood pressure reducers ever studied. But the next question is, when is your pressure actually most dangerous? Because there's a specific time of day when most cardiac events happen, and the third food on this list is specifically designed to protect you during that window. The most dangerous time for your blood pressure is between 6 a.m. and 10 a.m. This is when your cortisol peaks. Your arteries are at their stiffest, and it's when the majority of heart attacks and strokes happen, particularly in adults over 60. Which brings us to food number 3, the one I want you to eat in the morning, on purpose, for this exact reason: blueberries. A 2019 study from King's College London, published in the Journal of Gerontology, followed 40 healthy adults for 1 month. They consumed a cup of wild blueberries daily. By the end, their systolic blood pressure had dropped 5 millimeters of mercury. The researchers said this was the same magnitude as some prescription medications. The compound responsible is called anthocyanin. It's what gives blueberries their deep blue color, and it does something remarkable inside your body. It improves the function of the endothelium, the inner lining of your blood vessels, within just 2 hours of eating them. The trick is consistency. A handful, 3 to 4 times a week, won't move your numbers. You need about half a cup to a full cup, daily, ideally in the morning. Frozen wild blueberries are actually higher in anthocyanins than fresh ones from the grocery store because they're picked at peak ripeness. Put them in oatmeal. Eat them straight. Blend them. Just eat them. Food number 4. And this one isn't a vegetable. It's a fish. Fatty fish. Salmon. Mackerel. Sardines. Herring. If you're still watching, this next part is the most important so far. Most people drop off here, but if you stay with me for the next 5 minutes, I'm going to show you the single food that in one clinical trial performed comparably to a starting dose of a real blood pressure medication. So stay with me. Here's why fatty fish belongs on this list. A meta-analysis published in 2022 in the Journal of Clinical Hypertension reviewed 71 trials involving over 4,900 participants. The conclusion? People who consumed 2 to 3 grams of omega-3 fatty acids daily saw their systolic pressure drop an average of 4.5 millimeters of mercury. The mechanism is elegant. Omega-3s, specifically EPA and DHA, reduce inflammation inside your arteries. Inflammation is one of the silent drivers of high blood pressure that nobody talks about. Less inflammation means more flexible arteries, means lower pressure. The American Heart Association recommends 2 servings of fatty fish per week, but for blood pressure benefits specifically, the data suggests 3 to 4 servings of about 4 ounces each. That's roughly the size of your palm. A note on supplements. Fish oil capsules work, but not as well as the real fish. The whole food contains additional compounds, selenium, vitamin D, certain peptides, that work synergistically with the omega-3s. Eat the fish if you can. If you don't eat fish, walnuts and flaxseed contain a different omega-3 called ALA. Your body has to convert it, which is inefficient, but it's still better than nothing. About 2 tablespoons of ground flaxseed daily is a reasonable substitute. Quick reminder, if you're on blood thinners, talk to your doctor before significantly increasing omega-3 intake. They can interact. Now, greens, beets, blueberries, salmon. 4 foods, 4 mechanisms, all working together. But the 5th food on this list is the one I've been waiting to tell you about, because it's the one that surprised me the most in 30 years of practice, the one with the strongest head-to-head data against actual medication: garlic. I know what you're thinking. Garlic? The thing in my pasta sauce? Surely not. This is the food I want you to remember above all the others. Because of all the foods I've ever recommended to patients in my career, garlic has produced the most consistent, measurable, dramatic results. In 2013, a clinical trial published in the Pakistan Journal of Pharmaceutical Sciences directly compared aged garlic extract to atenolol, a common beta blocker. 210 participants with high blood pressure were divided into groups. After 24 weeks, the garlic group saw their systolic pressure drop an average of 10 millimeters of mercury. The atenolol group saw a similar drop. The garlic worked, comparably, to a prescription medication. And this isn't the only study. A 2020 meta-analysis published in Experimental and Therapeutic Medicine reviewed 12 trials. The conclusion? Garlic supplementation reduced systolic blood pressure by an average of 8.3 millimeters of mercury and diastolic by 5.5 millimeters of mercury. The authors specifically noted that these reductions are comparable to standard antihypertensive medications. Why does this work? Garlic contains a compound called allicin. When you crush or chop fresh garlic, an enzyme converts a stable compound called alliin into allicin within about 10 minutes. Allicin then helps your body produce hydrogen sulfide and nitric oxide, both potent vasodilators. Here's the part nobody tells you. Cooking destroys most of the allicin. If you throw whole garlic cloves into a hot pan, you get flavor but very little blood pressure benefit. The right way to use garlic, and I want you to remember this, take 1 to 2 4-trash cloves, crush them with the flat side of a knife, let them sit on the cutting board for 10 minutes. This activates the allicin. Then you can add them to whatever you're cooking at the very end, off the heat so the temperature doesn't destroy what you just activated. If raw garlic is too intense, aged garlic extract supplements work. The dose used in the clinical trials was 600 to 1,500 milligrams of aged garlic extract per day. Brands like Kyolic have been used in much of the published research. Let me tell you about Robert. He's 72, retired engineer from Asheville, North Carolina. He came to me reading 158/96. He was on 3 medications, and his doctor was talking about a 4th. He was exhausted. The medications made him dizzy. He was scared. I told him to try one experiment for 8 weeks. 2 crushed garlic cloves with dinner. A handful of blueberries with breakfast. 1 cup of cooked greens every day. 3 servings of salmon per week. That's it. He came back at 8 weeks. His reading was 134/82, almost a 25-point drop in systolic pressure. His doctor was so surprised, he asked Robert what he'd done. Robert told him. The doctor took 2 medications off the list. Now, I have to be careful here. Robert worked closely with his doctor through this entire process. He didn't stop anything on his own. He added the foods, his numbers changed, and his doctor adjusted the medications. That's the right way. This is not about replacing your medication. This is about giving your body the raw materials it actually needs so that, with your doctor's supervision, you might one day need less. Here's exactly what I want you to do this week. First, write down your current blood pressure. Average 3 readings, taken over 3 days, in the morning before coffee. This is your baseline. Without it, you can't measure change. Second, pick 2 foods from this list to add this week. Not all 5, 2. Most people fail because they try to overhaul everything at once. Pick the 2 easiest. For most of my patients, that's blueberries in the morning and crushed garlic at dinner. Third, track what you eat for the next 30 days. A simple notebook on the kitchen counter is fine. Don't track calories. Track whether you actually ate the foods that day. Consistency is everything. Fourth, retake your blood pressure at week 4. Same time of day, same conditions. Compare it to your baseline. And fifth, this is non-negotiable. Talk to your doctor about what you're doing. Show them the numbers. If your readings start dropping, your medications may need to be adjusted. Do not adjust them yourself, ever. This is a slow path. It's not a miracle. But in my 30 years of practice, I've watched it work on hundreds of people who'd been told their blood pressure would only ever go up. Your heart has been working for you for 60+ years. Every beat, every breath, every quiet moment. It hasn't asked for much. I'm asking now. Give it greens. Give it beets. Give it blueberries, salmon, and garlic. Give it the raw materials it's been waiting for. If this helped you, next week I'm releasing a video on the 3 things most adults over 60 do every morning that spike their blood pressure within an hour of waking, and how to reverse all 3 in under 5 minutes. You don't want to miss it. Take care of your heart. It's been taking care of you. I'll see you next week.